Hello, everyone. Welcome back to the Goody Life, where life is good and everything is great. I'm Dr. Goody, and if you're new to my channel, the Goody Life is all about finding motivation, inspiration, and self growth in all different aspects and areas of your life. And I'm super duper excited for the next month of videos that I'll be putting out. So, as you guys know, the Goody Life focuses on 5 areas of personal growth and development. And one of those areas is health and wellness. And I share a lot and I talk a lot about the importance of taking care of one's health and just to have a healthy lifestyle in general. When I did these videos last year, I had a lot of positive feedback from you guys, and you seemed to like it because we went down into different areas of health and wellness, such as fitness, yoga, nutrition, meditation. And when I did that, I had experts from each and every one of these areas that came in and talk about the importance and the values of having a healthy lifestyle. You guys seem to like those videos, so I'm doing it again this year, a full month of health and wellness, where I talk about the importance about incorporating and taking care of yourself in a healthy way, be it through fitness or through your nutrition or even something as simple as yoga. The difference is, as you know, I am an expecting mommy, so I will be focusing more on the health and wellness of moms, of pregnant mom. So it'll still be a full month of health and wellness, and I think anyone and everyone can benefit from some feedback, whether you're trying to get pregnant, you are pregnant, or after the baby. These topics are going to cover fitness again, the same, nutrition, yoga, and I'll be bringing in all licensed prenatal nutritionists or fitness instructor, where they talk about the importance of exercising during pregnancy or having a good nutrition while being pregnant, and just learning more about health and wellness in general throughout one pregnancy. So I hope you guys like all these videos that's going to be coming throughout this month, and I'm just going to get started and moving right away with nutrition this week. Let me introduce our registered nutritionist, Jamie Adams. Hi, Jamie. How are you?
Hi, Dr. Goody. Good. How are you? So excited to be here.
Yes, thank you so much for taking some time off out of your day.
Yes. Yeah, it's wonderful. I'm honored to be here and excited for this conversation between a mom to be and a new mom, and to share all this information with those on their motherhood journey as well.
That's right. And instead of me giving a brief intro of you, why don't you tell us a little bit about yourself, your background, and maybe what got you into nutrition, and specifically prenatal nutrition?
Yeah, I am a registered dietitian specializing in infant, child, and maternal health, specifically in pregnancy. And I am a registered yoga teacher, as well as certified prenatal yoga teacher. And now a new mom to be. So I have a little girl who is 2 months old at this point of our recording, at least. And so, yeah, that was a little bit about what sparked my interest. So, I've been working as a registered dietitian for over 5 years in infant and pediatric nutrition. And it was about 2 years ago when my husband and I were starting to talk about. Starting a family of our own one day, that sparked my interest more in maternal health and wellness. And that's when I started seeking out more educational opportunities in maternal nutrition, as well as my prenatal yoga teacher training. And with this vision of starting Mamaste Nutrition. So I started my own practice just over a year ago, in where I work with women from preconception through pregnancy and postpartum, as well.
you have a lot of knowledge. I can tell already. You have the and one of the things that makes it so much, I think, even myself as a soon to be mommy, you know, it's not only about the knowledge or the expertise of that's very important having that. But I think also it connects a lot when you hear, okay, you also just became a mom. So you definitely is going through this, have gone through it. So it's like a combination of all of that. I'm gonna go through a random set of question, things that as a soon to be mom, I came up for myself, how these things are important. And one of the things that really stood out to me, I've always been into health and wellness, always had a pretty good diet, physical fitness is always something I talk about. Even last year in my YouTube channel, I focus on 5 areas, and one of the areas is health and wellness. And one of that under it is nutrition. And when I became pregnant, I realized nutrition can vary and be very different for one in comparison to what they may have been used to in their regular day-to-day lifestyle. So how do you explain the value and the importance of nutrition and also having a nutritionist during someone pregnancy?
Yeah, great question. I think it's not talked about enough with our providers, right? I think, like you mentioned, I, as a new mom myself, I didn't really know what was being told to moms or moms to be while they were going through pregnancy from their other healthcare providers until I was in it myself. And that's when I experienced that it really wasn't talked about often enough. When, in reality, the American Pregnancy Association actually recommends making diet and lifestyle changes 3 months to a year before even conceiving. So we're not really even hearing about it until we already are pregnant from our providers, when really it's something we should have been working on, well before then. And so a dietitian can help along the whole process. So I have clients coming to me who are seeking out help for fertility in particular, both men and women, so their partners as well, because nutrition and lifestyle can play a huge role in our egg and sperm health to make happy and healthy babies, as well as our hormonal health too. So we want to make sure we're having a regular menstrual cycle and just being healthy overall. So that way, when we do conceive, we know that this is a good embryo quality. And then during pregnancy, I often work with women who have, like you mentioned, their diets may not be the same as what they were pre pregnancy. So, women who have rather restrictive diets, whether it's from a food allergy or um, just out of preference to have more of a restrictive diet, and they're realizing they're not meeting those nutrient needs they need for the baby themselves. I also work with women who may be diagnosed with gestational diabetes midway through their pregnancy, and then all the way through postpartum. So, women who are choosing to breastfeed, making sure that we're optimizing their milk supply, as well as if their infant has a food allergy, such as milk or soy, how we can navigate that. And I do have some women coming to me seeking out support in weight loss safely postpartum as well. So, as you can see, there are many ways that you can work with a dietitian all throughout the whole continuum, pre to postpartum.
And I like the fact that you mentioned it's really important if someone is planning to get pregnant or they are even in their first trimester. For me, I did not find out about the importance of nutrition when it came to pregnancy until my later part in my second trimester when I had to
Mhm.
do the glucose test. And that's when I realized how much different it is. And even if you're a healthy person, if someone is a very active person, they eat well. Again, like I said, it is very different then from when you're pregnant. And I'm glad you mentioned that it's important for them to know even 3 months before or a year before so they can know how to work on these things to
Mhm.
have a healthy pregnancy or to make sure they are eating the right things because waiting to find out, I think, later on in second trimester, maybe you could have prevented something. One of the things that for myself that recently happened when I did the test is I found out I had gestational diabetes. And it really impacted me in such a way that I was thinking, whoa, I did all this healthy eating, all this exercising. How is this possible? But it was a lack of knowledge that I wasn't aware so much of all these other factors that plays a part during your pregnancy. So maybe if having a nutritionist, having a dietitian that provided us with that information earlier on would have been very beneficial.
Yeah, definitely. Like you mentioned, some women may not even know that they're pregnant for a few weeks to even a month or two until they find out they're even pregnant. And during those first 2 months is a critical time period where the baby's brain and nervous system are developing, their organs are already starting to develop. So we need those key nutrients that help our cells grow and multiply before we even know that we may or may not be pregnant. And like you mentioned, it's in our second trimester that we have the glucose tolerance test. And again, we're not really even talking about that until the day comes and they're like, okay, you ready to sign up for your glucose tolerance test? And it's unclear whether or not that diet plays a role before we even take the glucose tolerance test, which I definitely think when it comes to gestational diabetes diagnosis, I often have women coming to me tearful and scared when they first see those lab results that they came back positive, and then they don't even have a appointment with their provider until another week or two after that positive test, and so they don't know what they should be doing even during that time period before they see their provider, who may not even be a dietitian or someone who is a certified diabetes educator yet. So, I do think it's really important that we do make women well aware of the fact that it's not necessarily their first trimester or even beginning second trimester diet that is causing gestational diabetes. If they nothing that they did caused their gestational diabetes. And I think as soon as a woman hears that, there's a sense of relief that kind of falls off their shoulders. And, they don't hear that from their provider for another week or two. And so they can be very stressed and tearful and tense for 2 weeks, not knowing what to do. And I also think the number one thing that they're told from providers is to cut out carbs because carbs cause diabetes. And that's not necessarily the case here. We need carbs as pregnant women for energy. It's more of how can we rather manage our blood sugars with diet. So while our diet alone doesn't cause gestational diabetes, it's more so our hormones, a history of gestational diabetes in a previous pregnancy, a history of diabetes in your family. If you are a little overweight or obese, that can play a role into it, but it's not the end all be all. I have women coming to me who have none of the risk factors, and they have, like you said, have been consuming a really healthy diet in their first trimester, and this happens. And it's those hormones that just change from our placenta, all of that. So, I do think that that education and that conversation needs to be had earlier on. I do have, a guide to managing gestational diabetes available on my website. It dives into a little bit more of what gestational diabetes is and key steps to managing your blood sugars after having that diagnosis. And I think the key takeaway to managing your blood sugars is really how to pair a carb with a protein with a fat. And this is very individualized, but that is the key, is having your carbs, proteins, and fats all together and finding a healthy balance there.
This topic can be a whole speech by itself, and there's so much to delve into. Even I mentioned earlier in my intro that I will be also talking about this more in a separate video myself, because there's just so much to these things. But just to give someone an idea how important it is for us to know about it,
And think about nutrition earlier on. Don't wait for that second late
Yes.
part of the second trimester. Start working on these things, start finding out about these things. And one of the best way to do that is maybe getting some guidance from a nutritionist or a dietitian.
Yes.
Yeah.
Yeah, even as a dietitian myself, like I mentioned, as soon as my husband and I knew we wanted to start a family, I started looking into what are the key pieces of nutrition for fertility, for pregnancy, before, even trying to start a family. So definitely the earlier the better.
Since we're kind of talking about this topic already about gaining information and gaining the right type of information, like you mentioned, if someone is talking to their primary care physician, that does not mean they're necessarily, or their gynec, that the person is a dietitian or a nutritionist. We all have different areas that we're expertise in, and we should we stay focused on those things. And that's one of the reason when I do this health and wellness, I am not a nutritionist. It doesn't matter if I eat healthy. What matters though is when we're talking about it, having someone who actually has the background in this type of information that's providing it and sharing it. I find it to be much more credible and much more helpful. And when we're pregnant, we're already going through all these hormones, these
Mhm.
emotions as is. But information is coming from everywhere. You have the family who has become the expert, the best friend who has become the expert. Then you have all your professionals who's giving you all these feedback as is. I don't know if you have had this happen, but I personally have had it happen to me throughout this journey. And knowing when to set that limit and how to set that limit for ourselves, especially during this journey of pregnancy, to keep our stress down, to not feel overwhelmed, to not feel frustrated. What are some feedback you provide to moms out there or pregnant women? How do they limit this information and know that they are getting the right kind of information, and it's not just taking things from what everybody else said and everybody else who was pregnant or however it is? How do we help ourselves in that case?
Great question. I definitely, even as a dietitian myself, I've been given nutrition advice throughout my pregnancy from friends and family and other healthcare providers. And so, I think my recommendations here would be to question who the source of the information is coming from. So, like you mentioned, is it a medical provider? Is it is it their physician? Is it a physical therapist? Is it a midwife? Or is it a dietitian? And yes, all of these other providers do have some background in nutrition. However, a dietitian is the expert in nutrition. We have a wealth of knowledge from our undergraduate degrees and our internships, and many have their master's degrees now as well. And so, I would recommend going to a dietitian for the nutrition expertise. And if you are reading a piece of information, whether you Google something and find it online, if you're looking at a blog post, see who wrote that at the bottom. What kind of provider was it? Were they a provider at all? Or is it a mom who just is really interested and passionate about nutrition? And there's not a bad piece to that in any way, shape, or form. They are passionate about that information and they probably found what works for them. So, my recommendation would be to question who the source is, do your own research. So, see what research is out there, and again, who that research is coming from, and then take what works for you and just leave the rest behind. And if you have that family member who's nagging you on their recommendation, you can always kindly say, I'm very happy to hear that this is what worked for you in your pregnancy. However, I'm going to do my own research to see what works best for me and my body, because nutrition is very individualized.
This is very important. The part you mentioned, it's very much so for each person. It is an individualized thing. Depending on certain culture and certain background. For myself, I am from an Indian background, and one of the things one of the feedback or advice that we get a lot is you have to eat because you need to nourish the baby. You need to make sure the baby is growing. But it doesn't necessarily mean we have to consume all these things. And like you said, none of these information are meant to be harmful. None of it is meant to be bad. It's just that as parents or family, or like you said, just a mommy who have tried some stuff and they found that it had worked and they wanted to share their knowledge so bad, but we still must remember that when it comes to nutrition, especially because we're intaking it, is the part that goes right into our body, that we really look at it more individually and not just grab information from any and everywhere. One of the things, I don't know, you maybe get this question a lot as a prenatal nutritionist, right? And I'm going to ask you one more time just for my video. What are some tips you have for expecting mommies out there?
So I have, worked with many moms navigating diet through pre-pregnancy, pregnancy, and postpartum, and I myself have gone through it as well. And I would say my two key tips here would be to one, practice intuitive eating. As you mentioned earlier, we already have all of these emotions, all of these hormonal changes going on. We, as women going through pregnancy, are very already in tune with our bodies. And so taking it one step further and being really in tune with our eating habits as well, and just practicing what's called intuitive eating. So honor your hunger cues, honor your fullness cues, and give yourself permission to eat the foods you're craving. And I think we're going to talk about this a little bit later, and get in depth a little bit more. But again, just practice that intuitive eating, really just give yourself some grace and honor yourself. And then number two, to kind of help you practice intuitive eating, would be to ask yourself these three questions. Will this supply me with energy and protein to help grow my baby? Will this meal provide me with a variety of key vitamins and minerals? And the key to knowing that is whether or not your plate is filled with a bunch of different colors. And then lastly, will this satisfy me and make me feel good? And that will help you to feel confident, to know that you're nourishing both your body, your baby, and satisfying a lot of those cravings you may be having throughout pregnancy.
Talking about intuitive eating, and that led me to think right away of my first trimester when I got pregnant. And one of the things I was feeling a lot, I did get I was one of those people who got ill during my first trimester. So I stopped all the exercising that I used to do and the way I used to eat. And I was actually in my bed quite a bit because I was so nauseated. It was so difficult to get up and get out of bed. And I was consuming a lot of my food still. And one of the things you hear from professional is you're not eating for two, you're eating for one still, which one of the other thing that I got a feedback from throughout the pregnancy is about 400 calories or so more that you would need to consume for the baby. So talking about intuitive eating, what's your feedback on that? Are we eating for two or are we eating for one? So we don't feel that pressure.
I would say we're not eating for one anymore, but we're also not eating for two. So there's not a clear cut answer there. But in reality, the first trimester of our pregnancy, our calorie needs don't really change. Our protein needs do increase a little bit in the beginning of our pregnancy, but in the first trimester, we kind of treat it as though we're still, not pregnant in terms of overall mass amounts of food on our plate. But we do still want to focus on the nutrients that are there on our plate too. So again, still not just going and grabbing for that candy or another snack here and there. But then in our second and third trimester, they do start to, our calorie needs do start to increase. So 300 to 500 calories in the second trimester and 400 to 500 calories in the third trimester are the conventional recommendations. But again, going back to everything is individualized. And so it does depend on also how physically active you are, too. Like you mentioned, you kind of cut back on your physical activity in the first trimester. Some women are more physically active in their first trimester. So they may need additional calories during that time. And to also take it away from thinking about it from a calorie perspective, I like to put it more so into a food perspective. So rather than thinking, oh, I need to eat 300 more calories today, I need to have one more small snack in a day. And then in the third trimester, I need to have one more mini meal or two additional snacks in a day. And when we think about it that way, I think that gets our mind off of this calorie, a numbers perspective. And it also takes away from doubling our portions and or just keeping our portions the same. It's more so, let's add another snack in here. Let's add another mini meal here. Because as you know, and I've experienced as well, that appetite really does increase during pregnancy. And if your appetite is telling you that you're hungry, coming back to that intuitive eating, have another snack and honor that.
I'm glad you talked about the snack part. See, this was something that was missing after my dinner time. And I think it may have played a little bit into my gestational diabetes too. So dinner for me
Mhm.
was done at 4:30. Now, waiting to eat breakfast again, that's a long time. And, your body starts having the sugar and then all of these other things that plays a part to it. And
Mhm.
turned out that that's what was needed for me is that I actually, not just that snack, but I had to add a small meal also to later in that night. And it made a huge change to my diet. So, yeah, having those snacks and knowing if you have to add another meal. So it's not about just that dinner, making that portion a bit bigger or making lunch a bit bigger. It's really separating it out also plays a part.
Yes, because coming back to our hormones, which really do play a role in our blood sugar levels, and even if you don't have gestational diabetes, your blood sugars can still fluctuate. And to help manage those to stay a little bit more steady, we do want to be eating a little bit more consistently and every few hours rather than making three large meals, because that's going to lead to a huge rise in your blood sugars and a straight fall in your blood sugars, whether or not you have gestational diabetes or not. So I like thinking about it as adding on another snack in the second trimester and adding on another mini meal in the third trimester.
Absolutely. And this is just across for everyone. Healthy pregnancy or whatever, they just need to make these little changes. So while we're on the topic of food and how much we eat and calories and all those things, one of the things also I don't know if you get this question a lot is about junk food and having cravings. And as you're going through this journey, we feel like, oh, we want to eat this a little bit more during our pregnancy, or something that we may not even eat at all. For example, in my day-to-day lifestyle prior to pregnancy, I don't really eat ice cream. To be honest with you, I never had I just wasn't a sweet tooth kind of a person, so I didn't have those craving much. But that changed a bit during my pregnancy. I actually was craving ice cream and I wanted to have it, or that was one thing that changed. And the next thing also is I found myself eating out at least once a week. So how for a mommy who might be struggling with these things where they may be consuming a bit more of these craving, or be it if it's a little bit more unhealthy along the line of junk food, what are some tips for them or for myself?
Yes, yeah, that's definitely a question and something I work with my clients a lot on. And again, this comes back to intuitive eating. So kind of tuning in with your body. really touching base as to, is your body craving this, and are you really wanting this, sweet tooth, or do you really have this desire for these salty foods in the moment? Or is it because it's something that's already in sight and you just see it, and then you're like, oh, well, I see it, so now I must have it, and I have this excuse, quote unquote, because I'm pregnant, that I can eat whatever I want. And so, again, tuning into your body, do you really crave this? And then asking yourself, why am I craving this, and what it is that you're craving. So you mentioned ice cream was something that you were craving a lot during your pregnancy, and that was a big thing for me too. And prior to pregnancy, I was not a dairy eater. I didn't really eat a lot of dairy, but I was constantly craving ice cream and milk. And that's telling me, okay, well, what's in ice cream or milk that is needed in pregnancy? And calcium is a big nutrient in dairy products, and that our calcium needs increase during pregnancy. So maybe my body is really just craving foods with calcium to help nourish and grow my baby's bones for a strong bone structure, as well as a little bit of the sweet tooth too. So knowing why you're craving something can help. Same with chocolate. Chocolate is really rich in magnesium, which is another nutrient that increases in need during pregnancy. So many women who are craving chocolate may actually be lacking magnesium in their diet. And so, honoring those cravings, but also knowing why we're having those cravings can be helpful too. And a few ways to kind of honor those cravings while also feeling satisfied and good about the decisions that you're making and the foods that you're eating. For sweet foods, I often recommend my clients to add in some fruit, make some smoothies. You could find nice cream recipes, which I have in a few of my recipe books that I have available on my website as well, and enjoy that ice cream. So rather than going for a 2 or 3 scoop bowl of ice cream, honor the craving of ice cream, have a scoop of ice cream, top it with a few berries and maybe some nuts to make it a little bit more nourishing as well. And that way you can leave there feeling, one, more full and satiated because you have the fiber and the protein from the nuts and the fruit, but you're also feeling satisfied because you've now honored those cravings of the ice cream. And for salty foods, you could make your own kale chips. You can make your own sweet potato fries. You could do salted nuts instead of diving into a bag of chips, or salted popcorn. And you may be craving salty foods because of iodine, which is found in salts, which also increases in need during pregnancy, too. So, salt isn't always a bad thing, right? And again, this comes back to individualization. So work with your dietitian or healthcare provider as to whether or not you can increase your salt intake. But if you are having those cravings, that may be why. And those are a few ways that you can kind of go about honoring them, as well as roasted chickpeas or salted edamame. So you're you're satisfying the salty cravings, but also getting a nourishing food with that too.
This is really good to know this type of information, because sometimes when you do crave that ice cream or you do crave that chocolate, we may never think about it. Oh, maybe the body is just looking for that calcium or that
Mhm.
magnesium. And there are alternates that you can use that would really actually satisfy that needs also, because that's what the body is specifically seeking. So once you give it that stuff, it feels well.
Yes.
As we're talking about, how to satisfy our needs, and especially having a good nutritional balance during our pregnancy. Like for most mommy and myself, we have full-time jobs. I'm pretty sure you have full-time job, right? So it can get busy. It can get hectic with a full-time job. Some people already have a baby or two babies, and just family and everything. It get hectic for them. So how do they find that balance to make sure they're eating the right stuff? Make sure they remember to put that snack in, that 3 p.m. snack or that 10 a.m., morning snack. How how do they try to find that balance for themselves and also at the same time not feel pressured just because just doing this nutritional plan itself for someone takes
Mhm.
quite a bit, and then you have everything else that happens with your day-to-day life and you're pregnant and all of these things. So how do one find that balance for themselves?
Great question. And like you mentioned, I had a full-time job while I was pregnant, all the while starting my private practice and doing a few other like side jobs on the side as well. So it's definitely a busy time for me. And so some tricks that I've kind of played around with and some things that have also worked for women that I work with, I'd love to share with you. And I would say the key here is to plan ahead. And I think when it comes to talking about meal planning or meal prepping, and we have that word out there, a lot of women or men really do um, feel like that takes a lot of time, and it doesn't have to, right? Some people can take a whole Saturday where they plan out what meals they're going to have for the week. They make their grocery list, they go to the grocery store, they come home, they chop up all their fruits and vegetables, they start prepping a few foods ahead of time, and that's their entire Saturday. But like you said, that might not be realistic for very busy moms, especially those who have toddlers running around, or if you have something on your schedule that day. And so you can break this out into smaller bite sized pieces. So, what has worked for me what is to take a few minutes on your Saturday, my Saturday morning. It can be the middle of the week, it doesn't need to be a weekend, to kind of plan out my meals for the week ahead. And then maybe on Sunday morning, I'll put my grocery list together, and then maybe on Monday, on my way home from work, I would stop at the grocery store, pick up those groceries. And then on Tuesday, I would prep everything. And then I would have, prep food from like a Wednesday to a Wednesday. And then the cycle starts over again. It doesn't all need to happen on the same day. You can break out those meal planning and meal prepping pieces apart from one another. But having overnight oats, chia pudding, energy bites, frozen meals, soups, all ready in your home, ready to grab and go. That makes those busy days, whatever those days are for you, so much easier. Where you can now just grab that chia pudding from your refrigerator before you head out to work. Also, giving yourself some grace and not feeling like you do need to have everything made from scratch. You can have a few nutritional bars on hand. I'm not affiliated with them by any means, but like Lara bars or Mama bars are some great products that I love to just have as a grab and go. Having fruit constantly stocked up in your home, along with some nuts and nut butters. That way, you can just grab a fruit, you can grab a prepackaged single serving nut butter on the way out the door for your 3 p.m. snack. So having those foods already in your home, um, prepping them ahead of time, and knowing that they don't all need to be made 100% from the ground up. You can have some of those, if you have a really busy week, rather than chopping up your vegetables, buy some frozen already chopped vegetables that you need for the week. Some frozen vegetables have more nutrient value than fresh vegetables because of when they are, preserved, and they hold their nutrition versus vegetables that may be out of season. So I think those are a few of my recommendations for kind of how to make sure you're still choosing healthy food choices during pregnancy while still being, able to have some time to have that, especially when you are a busy mom. And this is during pregnancy, and it also is going to come up postpartum too, because you're going to have a newborn, you're going to be tired, you're not going to feel up for prepping everything ahead of time. So, for the postpartum period, having some prepped food in your freezer has been a saving grace for me and my husband and our family afterwards as well. And I do have an ebook. It's called Nourish Your Mamaste, where I have recipes for the first, second, third, and even postpartum fourth trimester, which some do include many of the prep ahead recipes that you can utilize as well if anyone wants to check that out.
I'm glad you're mentioning these because these additional resources so helpful for
Yeah.
someone out there who's trying to figure out how to set up a healthy eating pattern or how to find that balance for themselves. One of the things I heard you say or that I found beneficial is pre-prepping a bit, but also being conscientious of when you're doing your grocery shopping. Sometimes like buying those cut up vegetables already is not a bad idea. Sometimes just having it so you can just grab it, or those pre-packet individualized nuts or cheese. It just makes it a bit easier. Maybe that day you don't have time to put that little bowl together, but you
Yeah.
just grab those individualized one, you dropped it in your bag, and then you head off and you can take it out and eat it. So either pre-prepping a little bit earlier or ahead of time, or having some of those individualized things already done so you can just grab it and go. So we're coming down to the last few questions here, and I think this one is also very important when it comes to our fluid, the liquid, how much water we're consuming, and the importance. We've always heard this: drink your water, drink your water, hydrate, right?
Mhm.
In this time, how much would you emphasize on drinking water and the importance of it? And also, sometimes liquid or having that is not necessarily just water, but you can have that source, like you said, when you're drinking a smoothie or you're having other stuff. I am a bit more careful with the juice, like the sugary juice that you buy in the bottle or something like that. So what are some tips when it comes to liquid and making sure that a pregnant mommy stay hydrated?
I would say this is probably more so talked about from our providers than nutrition itself is staying hydrated. It is very important during pregnancy. Our water and fluid intake helps with the increased blood volume that we have throughout pregnancy. It helps to transfer nutrients throughout the body. It helps to regulate our body temperature as well as our bowel regulation. So many women in pregnancy often complain of constipation, which can be hormonal related, but also their fluid intake too. So I recommend a minimum of 70 to 100 ounces per day of fluid intake. And this can definitely increase based on your physical activity. It can increase based on where you live. If it's a little bit of a warmer, more humid area, you may be perspirating a little bit more. You may need a little bit more fluid. And again, coming back and listening to your hunger cues and hydration cues as well. So one of the first signs of dehydration is actually hunger. So if you are having those hunger cues and you feel like you just ate, maybe having a glass of water may just satisfy that. Maybe you are just thirsty. And so, ways that we can encourage our bodies to drink more is to always have a water bottle on hand. I like to put um, headbands, or you could do a rubber band around my bottle. Mine is, 24 ounces. So I'll put 3 to 4 on there. And then every time I have one, I'll put it on my wrist. So I know how many I've drank already throughout the day as a little bit reminder, as well as having reminders on your phone as to when to drink. So, by 10 a.m., noon, 2 p.m., 4 p.m., 6 p.m., however many reminders you need on your phone in a day to make sure you're drinking and keeping hydrated can be helpful too. But like you mentioned, it's not only water that contributes to our fluid intake. Some of the fruits that we eat throughout the day contain a high water content, fruits and vegetables, as well as soups or stews that we might be drinking. um, Fruit juices can dehydrate us a little bit more because they are such a high sugar content. So being mindful of that as well. But ways to encourage our water intake in particular is what I like to do was flavoring it with already like cut up fruits and vegetables. So I make like a pitcher of cucumber water, so it is flavored naturally. And then it's a little bit of a variety, right? It's a little fun. You can make a mini mocktail of water using fresh fruits and vegetables or herbs and spices. You could put lemon in there, you can put basil, mint. There are a lot of different varieties you can make of just making your own flavored water in your home too. So maybe some of those ways can help encourage you to drink throughout the day.
And it really do work. Adding some fruits or, like you said, herbs to that water, it really changes the taste. Because I know in first trimester, if someone who was experiencing the same things like I was, where I was feeling a bit ill, I didn't even want to drink water. But adding all those flavor into it, it does make a difference, and it kind of helps you to take it in much more. So
Mhm.
that's really important. Add these little things to your water. It makes a difference. And also, it just flavors it up for you, right?
Yeah, a
So
little change.
yes, yes. So the
Mhm.
water intake, and again, one of the things you mentioned that I think is really important for people to know, it does make a difference depending on where you're staying, how much you're working out. So it's not a one size fit all here, because your body may need a little bit more where somebody may not. As we're moving down to the last two questions, one of the things that a lot of us probably, as we've had the baby, one of the questions we have, or I have, is the weight loss. When do we start working out? How much do we work out, and how fast do we lose this weight? And that can become a bit overwhelming for some mommies, depending on what their profession is, how fast they need to get back into a certain physique for themselves. But I don't focus. So for myself, it's like taking your time and getting there in the right way and in a healthy way, you know.
Mhm.
So for moms who may have that question about their body weight, or their losing that baby fat, what's your feedback and tip on like taking it slow or managing it in the healthy way and the right way after the baby?
Definitely. I have quite a few clients who I work with on a safe weight loss post pregnancy. But my philosophy, really is to nourish your body and to focus on replenishment rather than restriction in the immediate postpartum period. So, our body gained weight during the pregnancy period over 9 months, and that's a combination of fluid, the baby, blood volume, and much of that will come off immediately post pregnancy. But we did also gain some maternal fat stores, and that wasn't out of just an unnecessary need. We gain those maternal fat stores for a need, and that's to make sure that we have enough of an energy and nutrient store for the breastfeeding phase. So again, whether or not you choose to breastfeed or not is going to change a little bit as to when you can start focusing on weight loss, as well as how that weight loss is going to come off. So many women do start to lose a little bit more weight if they do choose to breastfeed, because we do burn a lot of calories while breastfeeding, but that's not the overall goal, right? Like, I'm not saying breastfeed to lose weight. It's something that's seen, and it's not necessarily encouraged if we can keep the weight on. We use and pull from those maternal fat stores to provide our body with energy to keep that milk supply up. So we need those maternal fat stores. Those were built for a reason in pregnancy. And it took our body 9 months to build and grow this healthy baby. So, I would say a good rule of thumb is to also expect it to take about 9 months for us to kind of start to gradually work our way back to our pre-pregnancy weight. Again, we're never going to go back to our pre-pregnancy body. Everything has changed both inside and out. But again, I safely start to work with women around 3 to 6 months postpartum on incorporating a gradual weight loss. And when we do start to work on that, rather than focusing on calorie restriction, we focus and switch the focus to the quality of the foods that we're eating. So in the postpartum period as well, right? So many women are like, man, I'm done like with this healthy diet for my baby. Now I can eat whatever I want because I don't need to focus on the nutrition for baby anymore. But really, this is the time where we need to focus on the nutrition for ourselves as well as what our breast milk supply does. Again, that's if you choose to breastfeed. What we consume can affect our breast milk supply, which is still nourishing our babies too. And so the American Academy of Pediatrics recommends women to breastfeed exclusively through 6 months. That's their recommendations. Again, you can have your own journey and make your own decisions as well. And I support women in both breastfeeding and formula feeding too. But that's where that 3 to 6 month recommendation kind of comes in, as well as taking an individualized approach and seeing whether or not it's an appropriate time for that woman to even start having that weight loss too. So rather than having the overall goal be weight loss, I like to have the overall goal be a nourished mama and making sure that they're getting the appropriate nutrients to replenish their bodies postpartum, which will eventually lead to a gradual weight loss.
I like that, a nourished mama.
Yeah.
We overall in general, there's so much that a mom goes through. And taking care of themselves, taking care of a newborn right after the baby is, arrived, and just going forward with life, like you said, it's very different.
Mhm.
You're like a different person in your body inside out, and all these changes that's going to happen. So remembering to care for yourself and caring for yourself in
Yes.
whatever way that may make you feel good, but having a balance also is very important for moms, so they take a little bit of that stress off of them. Jamie, thank you so much. You have provided us with so much information about nutrition, diet, and one's overall health from beginning of pregnancy, your first trimester, all the way to your third trimester. One of the things I found when we talked and just overall about you is you have a lot of knowledge and a lot of information on these topics. So if someone wants to find out more about nutrition or just learn a little bit more from Jamie, how can they reach you, Jamie?
Yeah, great. Thank you again, Dr. Goody, for having me on your channel to share and talk about this passion of mine, but also something that I've worked on career wise too, like you said. And so I'd love to support any woman in their pregnancy journey and becoming a nourished mama. You can find me on Instagram at Mamaste, so Mamaste nutrition, or you can find me on my new website, mamaste-nutrition.com. And I do offer one on one client services. I'm working on a group coaching program that will be up and running later this year, 2021. And I do, as I mentioned previously, have a few ebook resources. So, Nourish Your Mama Stay, as well as my guide to managing gestational diabetes. So, whether you're interested in just seeing some recipes that can help support you throughout your pregnancy or gestational diabetes, those books are for you. But I also dive a little bit deeper into the nutrients needed in each trimester and foods needed and necessary during gestational diabetes as well.
There you had it, how to get hold of Jamie and just also how to learn more about nutrition. I hope you guys like this video, and we will see you all in the next video. Again, Jamie, thank you so much for joining us today. And I think, Jamie, you might be joining us again and possibly talking about the importance of yoga.
Yes, I would love to come back on and have that conversation. It's made a wealth of a difference in my own body throughout pregnancy, and would love to again share that passion and expertise with all of you here too.
Yeah. So thank you so much, Jamie. And bye, everybody.